Howdy there, everyone. Matt here, Matt the PT, coming at you again. Another topic, thing to discuss that involves us in the world of rehab and healthcare in general. Just want to talk about it. And this is something that I would like to get all of y'all's opinion on and what you think and believe and how we can possibly overcome this. So if you've ever read any sort of research, the clinical treatment guidelines about back pain. And now I know I said a few weeks ago that people don't care about research. It's true. But we do. We look at research a lot. That, especially dealing with back pain, that things like, medications, injections, imaging, MRIs, x-rays, and surgery are largely not needed. So, like especially the use of medication and MRIs are like too heavily relied on and they're not really going to help with the outcomes. But there was an interesting paper I came across this week that somebody shared with me, and it talked about what people want with their rehab and their diagnosis, especially with back pain. And it was that they want a diagnosis, that they want to know what is going on. And that was the biggest thing. I believe that there was also, they just want like consistent information from providers. Also, they wanted it presented in a manner that was like the language was age appropriate and that they could understand. So pretty much just tell them what is going on. Tell me exactly what is causing my pain and what do I need to do about it in a way that I can understand. And this has led to something else that's went on. So on my clinic page, I am trying to be, cool and be on the internet and thing. And I post some stuff on here on YouTube about just the things that we talk about in therapy. And I try to present them in a manner that is entertaining, that people will understand. And whenever I put stuff about MRIs, oh my gosh, the comments, they go berserk in the comments. And it's not other. One was a doctor. There was a physician person said it was a physician. I don't know if they are or not. That was chatting back and forth, but the vast majority of the general population that was commenting were all saying that I'm not going to do therapy without an MRI first. Okay. Or saying like, oh, it helps you develop a better treatment plan. Or they had their story about, I did PT and I had all these problems and then they wouldn't figure it out until after I was tortured through therapy. And then I finally got the MRI and I wish I had got that done first. And one guy was like, I nearly passed out. And I'm thinking, did you really? Okay. I've had one person ever pass out in therapy. They were doing wrist stretches of all things, just wrist stretches. Don't know what happened. It was strange, but the only person I've ever had pass out wasn't from ever the work or anything else I have ever done. It's from wrist stretches. So I think this person's just exaggerating. But it brings up this thing, and I try to make a point of letting people know that those things that they want. So like, I want medications to fix this because I see that with people as well. And you may see that too. They're like, I want a medication to fix this. And I think that there is a part that people sometimes think that medication in terms of dealing with pain is a curative thing. Like if I got the flu, I take Tamiflu and it goes away, or I got an infection, I take this antibiotic and it goes away. That they think pain medication works along the same lines where it's like, oh, I take the medication and it goes away. So I do think that. And then like the use of things like x-rays and MRIs, CT, like those things, like they're going to give this like revelation of like, oh, this is what it does. And I tell people, if it actually did, because when they start snapping on there about how they did it, I was like, okay, if it actually told us what to do, we would get them first. We would have you go get an MRI first. Like, doesn't that make sense? And I said, well, a lot of us see patients through the insurance system. And wouldn't insurance companies see that value to say, oh, if you go get an MRI first, you develop a plan easier and you know what to do. So therefore, the insurance company saying we're going to pay out less money. So therefore, we'll pay for the MRI first and then get them into therapy. And then we're paying less money. But nobody ever thinks about that stuff. And so I really wonder. Exactly. And I also tell people, I'm like, look up, any of these guidelines or any of the evidence that is freely available on like Google Scholar, PubMed, just any of that, like look it up, and nobody ever wants to look it up. But the question is, how do we present that information in that manner that somebody would understand, that lets them know that things like medication can be beneficial in the short term, but it's not a long-term solution. That's not going to fix you. Or the fact that like that X-ray or the MRI for you, because there's no obvious red flags. That was what the physician was arguing with me about. I'm like, no, dummy. If they have red flags, I'm going, to do that. And you should do that if they have serious issues. Like, I'm not saying that. But how, like, that stuff does not help us. It seems so cool. All this, that we live in the future. It's this, if you've ever watched Star Trek from the 60s or whenever it was, like, they had that technology, but like, we have some of that technology now, but, it's not the same. It's not going to do that. And like and really like, how do we present this information where people understand this is not the proper way to go about it? And I understand as well when somebody is in that state, when they're dealing with an injury, they're dealing with pain, their thinking may be off in it. I've dealt with some pretty severe pain in my past from injuries and things like that. And it does affect your thinking. Like, I can't think very clearly because I'm in this intense pain. But really, like, how do we present that to somebody where they can understand that is age appropriate, that is like, educational, like appropriate for them to say like, oh, you're right. I don't need to do those things. I need to do this that's going to give me a better outcome. And then overall to trust us to say, okay, I understand that you want me to do this. I will do this. And that we can utilize that other stuff as needed on it. So it's this interesting thing. It's that thing. And I don't know how we go about doing that. I think it really does have to be a big collective agreement between all providers. So, especially like physicians, to do that, to let people know, hey, this is not how, you don't need this. You don't need, but I don't think we can really do that because there's always going to be providers out there who just like, we'll do that. We'll do, we'll give you all that. Is it through media? I wonder that too, because like if we look at TV shows that are medical dramas, they're always, their thing is like, let's get an MRI, let's get a scan, and they use that to diagnose. And so are people carrying that part over saying, well, they do this in TV and I see that in TV and they're mimicking what they see in TV to say like, oh, I need to do all that stuff. Is that part of it too? So I think it is a very interesting thing that we know this is how we should treat people optimally. Like, this is what evidence shows us that will treat people optimally. But over here is what people want, and it doesn't line up. And again, like we mentioned last time, people don't talk about, they don't read research. They don't look at, they don't care about that stuff. This is what I want. And this is, so how do we bridge that? I don't know. I've thought about it so much that it is a hard thing. I know we can't be super aggressive with it and deny people stuff, and people usually have to be open to understanding that that is the process. Maybe it comes down to we have to educate people when they're not hurting, when they're not in pain. That it's those times, and like, are we possibly trying to educate and talk to somebody at a wrong time when they are in a lot of pain and they're freaked out and they're scared and they don't know what to do and all these problems, and that's when we're trying to say, no, you need to move and you don't need heat and ice and the massage and the medication, but they're going like, I want that stuff because I think that stuff will feel good. They won't think the process out of those things, or like, oh, the MRI is going to tell them exactly what to do and I will pay whatever amount of money. I don't care right now because they're in that high emotional state. They're in pain, that they'll do those things. So very interesting conundrum as it is. So, well, let me know your thoughts on it. I'd like to talk about that to see how we can best talk about this. I do know that we can't really present it in a very like highly educated way, as therapists. We have, doctorate degrees. We have a high level education. Do all of our patients have that same high level of understanding? So I don't think we can present it in a very high level stuff because they may reject it by going, I just don't understand it, so I'm not going to listen to you. But how best do we let people know, like, we are going about it the most cost effective way, and we will utilize those things if we feel that they are needed. We don't often need them, and we're trying to help you. So, like I said, let me know your thoughts on it. I'm interested to talk about that and discuss this. So, let me know. If you like the video, please hit the thumbs up button. Of course, if you don't mind sharing this with somebody or commenting down below, and of course, subscribing to the channel. I'm trying to get more and more of this out every week. So take care of yourself, and I'll see you all next time.